I'm Suhail Mirza and I'm delighted to welcome you to a special episode of Voices of Care coming from the LaingBuisson Private Healthcare Summit here in London. Now, the theme of the summit is navigating the future together. And over the next two episodes, I'll be speaking to speakers at the summit and delegates about their thoughts and insights about the challenges that are being faced by the sector and the opportunities amidst fierce competition, a tight labour market and great macroeconomic uncertainty. I'm delighted to welcome Anita Charlesworth, Chief Economist at the Health Foundation. Anita, thanks for giving us your time today.
Oh, it's lovely to speak to you.
You've spoken at the summit now outlining the very significant turmoil economically and the impact on the sector. Taking away from it, what are the key things? I guess it's uncertainty together with a significant opportunity.
Yeah, I guess there are a couple of things. It feels like there are some tectonic plates that are moving and potentially some collision going on. And I think one of the things that's really important for anyone who's planning and thinking about future of healthcare to try to separate out what is the short-term one-off shock from some of the underlying dynamics. And there are two underlying dynamics which I think are really important in trying to think through our sector. One is we've had basically more than 10 years of very low economic growth. So we've got a cost of living crisis at the moment. People are very aware of that inflation. But actually, we haven't had sustained, robust economic growth. So we are poorer than we expected to be, poorer than many of our comparator countries are. That makes finding the resources for healthcare, either individually, privately, or publicly funded healthcare through taxation, really, really hard. That economic challenge has been happening at the same time as we've got a period of ageing of our population, rising multi-morbidity, which is leading to demand pressures on the system. And then also, of course, with some of that demographics, we've got a lack of growth in the working age population, and we need a healthcare workforce.
Now, those are big trends that we've got to navigate, which of course is the theme here at the summit. I wanted to step back looking at those underlying trends to look at the public sector, because there's a big debate around funding of the NHS. Can you put into context over the last decade or so the funding squeeze, not putting words in your mouth, but funding squeeze in relative terms, in real terms for the NHS, because that has to be the backdrop in which to understand the elective backlog and trying to solve it.
So obviously the last 10 years have seen most public services funding reduced. Health actually hasn't had its funding reduced. So we are spending more in cash terms, spending more after you allow for inflation on healthcare than we were back in 2010. The problem is that healthcare is like the Red Queen. We have to run to stand still. And so we've got more people needing more services, more things that we can do, and pressures on wages. And so healthcare funding over this last decade has increased at less than half of the historic average. And we've tried to bridge that gap by sweating our system, working it much harder. And even before the pandemic, fundamentally that strategy of constraining resources and trying to meet demand by pushing the service harder had run out of road. And we were seeing waiting times, waiting lists growing quite significantly, workforce shortages really growing, and a big backlog in maintenance. And so, I mean, the NHS is looking and feeling a bit shabby.
I think no one's going to disagree on that. Turning to the workforce, you've touched upon that. The numbers are clear, 124,000 vacancies, or 100,000 before in the NHS. We'll come on to social care in a minute. The pay deals that are being struck, and there is still, of course, some great uncertainty around industrial action. It's not a simple solution, the pay deals, because they have an effect on the funding themselves, don't they?
Yeah, I mean, I think it's really important, again, to separate out the immediate from the underlying. And we've got a number of underlying issues which we need to address wherever this pay, however this current round of pay dispute ends. We're not training enough staff across almost all of the professions. We've got a lot of people then been leaving very early on in their career, and we've got a general problem of retention, particularly because I think two things which have been happening. I mean, one is that one of the most important issues for staff is not pay, actually, it's can I do a good job? Do I feel like I'm coming to work and being able to deliver the quality of care that I would want? And a lot of people are feeling actually really quite a lot of moral injury and, are in the car park at the end of a shift in tears, feeling like, that was not the care that they would want to give to their loved one that they went into the service to deliver. The other thing that we've seen is that actually over the last 10 years, in this period of austerity, a lot of pay, where there has been money for pay awards, it's been put into lower grades and earlier career for really understandable reasons about cost of living. What that's meant, though, is that actually people reach the top, if you like, of their grade relatively young and they stay there. So NHS careers, in terms of starting salaries now, look pretty attractive compared to other options. But when you look 5-10 years into the career, then NHS staff are falling behind.
So there's actually a call you've said there. I mean, social care, let's touch upon that because we can't look at the NHS workforce in isolation. 165,000 vacancies according to Skills for Care. So we need to tackle both of those things. I guess there's also a call implicit in what you're saying for some innovation in terms of training and growing those numbers, as well as a cultural change in terms of making people feel included and actually well led.
Yeah, I mean, essentially what this points to is the absolute need for this integrated whole system workforce strategy, that looks both at the short-term problems but the full pipeline. What do we do around training? We've been so reliant on international recruitment as our get-out-of-jail-free card for the failures of workforce planning. Actually, the global labour market makes that strategy look really, really difficult. The US, Canada, Australia, all of these countries now being really active in the recruitment markets that we have used over the recent years post-Brexit as our source countries.
Now, there's also, of course, quite a powerful and contrasting dynamic because we've got to look at the broader labour market itself. That in itself has been transformed. We've lost a lot of people through the pandemic. So the relationship between productivity and labour market is complex, but something we can't ignore.
No, absolutely. And we're also seeing, when we think about social care, social care wages have risen partly because the living wage obviously has gone up. But actually in a lot of the other occupations that are available to people who are thinking about a career in social care, those wages their wages are rising much more. So actually social care wages are falling behind. And it's not just wages, it's wider terms and conditions packages. How do people manage their rent situation and all of their cost of living if they don't know from 1 week to the next what their hours are going to be? How do they manage childcare if they don't know which days they're going to be working? So all of these issues, and also if we're saying to people over and over again, social care is a great career. I passionately believe it has the potential to be a great career. But, the Skills for Care data shows if you're 5 years in to working in social care, you're earning less than 10 pence an hour more than someone who's just starting out. What does that say about the value of experience? These are people who are giving their all in jobs which are incredibly demanding, and we're saying to people, that experience, that contribution, it doesn't really matter.
Well, big questions. One final one, a bit of an alchemist question really. Role of innovation and the thorny issue of productivity, because we're not going to solve this just by doing what we've done. That's the definition of an insanity. Where do you see that? Because that's going to require some very out-of-the-box thinking. Yeah,
to some extent, this is a great time to have this problem because the rate of innovation is just phenomenal, isn't it? And what, for example, AI offers as a change agenda is absolutely mind blowing. What I think this all suggests is there is a real premium on thinking about labour-saving innovation and how we can harness the power of innovation, not just to reduce the amount of human input, but also to allow the human input to be the really quality human input, to enrich the quality of jobs, not undermine the quality of jobs, to create time to care. And that seems to me really important. The second thing, though, that you see with this is an enormous amount of the benefit that comes from innovation is when you scale. and then you can channel shift and you can mode shift. And in healthcare, so often what we've got is amazing pockets of best practice case studies that we can all go and look at and go, oh, we're just blown away by that. But we're so bad at systematically scaling.
Plenty to think about for policymakers and providers. Always a pleasure to spend time with you, and thank you very much for your insights.
Thank you so much.
My pleasure. So I'm delighted to welcome Dr. Ian Gargan, the Chief Executive of Private Healthcare Information Network. Ian, thanks for joining us. Really good to see you.
Lovely to see you, Suhail. Thanks for having me.
You're at the summit. There's some tremendous transformation taking place in the sector. What are the key things that you've taken away already from there?
I think one of the major numbers I've just heard is the number of ambulatory and outpatient care episodes that are taking place now. So far less stays in admission patient care, which is something that Fin are very interested. As you know, I'm the Chief Executive of the Private Health Information Network, fin.org.uk, and we look at admission patient care and some of those numbers. The order that we're mandated to deliver by the Competition and Markets Authority stipulates that we look at APCs and not outpatient data, but it's quite clear from this morning that data is very relevant to the patient population.
And that's extremely important as we transform models of care with more clinical-based care delivered in the home, in the community as well.
It's the absolute future, integrated care services, keeping patients out of hospital. We were always taught that in medicine, trying to do and engage patients so you can prevent the problems from happening and not going into hospital is very key. When they get into hospitals, you don't know how long people might have to stay. They could get sicker if they're very vulnerable to infection, etc. So that is the future as medicine innovates.
And looking at the private healthcare market, which is what the summit's focusing on in particular, we're seeing a bit of a bounce back, more than self-pay, PMI. Are your numbers showing that, and what does that imply for the sector?
So the self-pay is still an increase. Last year, just post-pandemic, it was up about 134% in some parts of the country, on average about 33% at about 72,000 people, whereas it was usually about 50,000 people self-paying before the pandemic. It's still much higher than pre-pandemic, and while it's coming down somewhat, we're seeing private medical insurance numbers increase. We've even seen reports this week that Bupa have an additional 250,000 customers, and generally 480,000 more people have bought private medical insurance. So I think we're seeing a decrease in one, but then an increase in the other. So generally the appetite for private healthcare is still on the bounce and on the increase. We don't see that changing.
And that's going to be in part driven by the growing and record numbers in the elective waiting lists.
I think everyone in the country knows that number at this point, 7.3 million. And I think one of the frustrations I'm hearing from patients is not just that the waiting lists are very long, it's that they don't have visibility where they are on that list, and sometimes they feel they're forgotten about, and of course they're not forgotten about. Our NHS is amazing, just not getting to the people quick enough. So as a result of that, people are getting worried and frustrated, and that's why they're choosing to go into the private health sector.
And I think the big issue, of course, whether it's private or the NHS, to deliver it, we're going to need staff. There's a tremendous shortage going on at the moment. I presume you're seeing that, and we've got, dare I say it, more strikes looming.
Well, clearly the nurses aren't happy with working conditions. It's just too stressful. And also the doctors are now going to vote by the 27th of June, senior consultants, on whether to strike or not. The junior doctors have been on strike, and they may do so again. What we've seen in our own workforce, and we're a not-for-profit, we do our work for the government, we see that the benefits of giving people incentive to work with us, like a noble cause, private medical insurance, other benefits in the workplace, can actually compensate for the lack of money sometimes that people are looking for. So it's not all about money. It's a lot to do with work conditions and feeling under pressure. When I was working as a doctor in A&E and as in orthopaedics, I never felt we were going to get on top of the list. There was always trolleys in the corridor, but I feel that's actually, it's got somewhat more acute and worse at the moment. And that pressure on people who are trying to give good care to other people, it's not sustainable, and there will be probably a lashback from the working population, nurses and doctors for sure.
And final question, obviously you're tasked by the Competition and Markets Authority in terms of information, transparency. How are we progressing with that? It's a very important element for patients to understand.
So that order was invoked in 2014. It's to be delivered by 2026. We're hoping to deliver stage one of that architecture delivery of the order by October 31st, 2024, with stage 2 in 25, and then final stage June 26. Architecture will be up and running, and we'll have all the doctors on their profiles up on our website on fin.org.uk, as well as full hospital compliance. I'm pretty confident.
Well, you heard it here from the horse's mouth. We'll look forward to seeing you again. Thank you for your time today.
Thank you, Suhail.
Pleasure. Delighted to welcome David Marshall, Chief Executive of New Victoria Hospital, to the podcast. David, welcome. Thank you for giving us your time.
Yeah, thank you very much for inviting me. It's a privilege.
That's a privilege is ours. The summit is very vibrant. What brings you here? Networking, obviously, but just to pick up on some of the key speakers.
Yeah, because there are some very interesting topics, and obviously, the networking is important to sort of meet old friends and catch up on how they're doing, how their organisations are travelling. It's common themes, problems across the board, which is always good to hear that you're kind of not alone. It's just an enjoyable sort of day out amongst colleagues and friends, yes.
And I think the key factor here, I mean, the private sector, the private acute sector, is now, from a post-pandemic point of view, the numbers suggest if not buoyancy, certainly a bounce back in terms of an increase in self-pay, PMI. Are you seeing that a lot more in terms of the figures and the work that you're doing?
We certainly saw an increase in the self-pay in 2022, quite significant jump. It's tailed off slightly. It sort of seems to have plateaued at the moment, but it's still a lot better than it was. We've seen a lot more of what I would call GP-type appointments with consultants, where traditionally that patient would go to a GP rather than come and see a specialist. But because they can't get to see a GP, they're coming to see a consultant. But nonetheless, we've seen a really large surge in the number of inpatient stays, which is contrary to what Health Code's data shows, is that our inpatient or overnight stays from a self-pay point of view have definitely gone up quite significantly.
And I think for the sector as a whole, there's a trend, of course, as you know, to have more clinical hospital-type treatment in the home, in the community. So perhaps that's driving some of the demand, in addition to, of course, the well-established elective backlogs in the NHS.
Yeah, definitely. I agree with that.
And in terms of the workforce, because that's the big theme that's come here at the summit, we all need staff to deliver the care that we want to deliver. How are you coping with that? Because it's not just an NHS issue, it's a private sector issue. The competitiveness for staff shortages, is that something that's high on your agenda, and B, what have you been doing about it?
Yeah, it's very much high on our agenda. We're not immune to the same problems that everyone else has. I think the interesting thing that it hasn't really been mentioned here is that we're seeing it across the spectrum of employees, so it's not clinically related now. We're seeing it in places like housekeeping, we're seeing it in catering, portering, where suddenly it's a lot more difficult to recruit to these roles. Now, they're the support services of the hospital, so they are just as important as a clinical service. We seem to have been able to retain a lot of our staff because of some of our terms and conditions, some of the good feel factor of our hospital, our culture. We've been around for 125 years. It's a nice place to work. We have a very loyal community. We've got a great reputation. Consultants love coming to work, and they tell us that we deliver such fantastic care that this is the place they prefer to bring their patients. So that helps us retain our staff. But it's not easy. Our pay as an independent organisation that has limited resources to offer bigger pay rises and match everyone else is not easy. So that is an Achilles heel for us. But we try, in terms of being the hospital that we are and the reputation we have and a nice place to work, to retain staff. But we still have the same problems when it comes to people like radiographers, physiologists, and theatre staff in particular. Those are the three key areas for us that have always been around.
So really you're talking about the culture. It's not just the paying conditions, it's the culture of the hospital which has led to this longevity across all different occupation groups. One final quick question. I know you have a wealth of international experience that you're drawing from around the world, and the challenge of workforce is ubiquitous across all global healthcare systems. Just getting your view, how are we going to solve that? It's not a simple question, but you've alluded to some of the specific clinician areas where there's shortages. Do we need to see a bit of a revolution or a disruptive approach to the way we train staff to actually grow the workforce?
Yeah, I think so. I mean, I was listening to the conversation that we had, the panel debate. Very interesting in terms of the educational side of life. I don't know enough about how it's changed from a nursing perspective and nursing apprenticeships and things like that. But I think there needs to be a lot more collaboration between government and private sector, because it is an ethical issue to go to the Philippines or to India, wherever, and bring their staff to us, leaving them with the same problem that we've got. We need to look at ourselves, because why are we not able to attract youngsters into the system who want to be nurses or who want to be clinicians or who want to be catering in a healthcare setting? I think there needs to be a lot more dialogue. I personally think that the government should be doing something about capping agency fees, because to me it's just ridiculous that, as somebody asked the question, staff member can join an agency, leave you, join an agency and come back to it at a much higher cost. To me that's unfair. I understand about flexible working and the ability to not have that rigid pattern that you have in an organisation, but I do think there needs to be something to be done about agencies to force those fees to be capped, because that is really hurting the private sector, well, especially a hospital of our size.
So the key there is going to be a broader, longer-term proactive approach, and collaboration, I think, is one of the key things you're talking about.
Yeah, and as somebody had put up a question, which is what I would have suggested as well, why can't we all contribute to some fund that is controlled, where we all then pool our resources and have access to them? I also think there should be a lot more closer relationship between, say, our local trust. They're a mile away from us. We work very well with them, but I'm talking from a staffing perspective. They've been quite resistant to that. I think some rotation through that to attract, say, a new nurse would probably prefer to work with an NHS trust than they would in a private sector, because you're isolated. But join the NHS trust, give us the ability to have some sort of access to that on a rotational basis, and we're helping each other. And then that member gets to understand what is the private sector all about, rather than just say, I work in the NHS.
I think that's a clarion call. Perhaps policymakers will be listening in. Thank you for your time. It's been a pleasure to meet you, and thank you for your insights.
Thank you, Suhail. I appreciate it.
My pleasure, David. Thank you.
All right. Cheers.
That's all from this episode of Voices of Care from the LaingBuisson Private Healthcare Summit here in London. I'd like to take the opportunity to thank all my guests for their insights and their candour. Plenty for all of us to think about, I'm sure you'll agree. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to understand how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you and goodbye.